Hello, everybody. My name is Jonathan Vita. This is my signature assignment on heroin addiction, and let's get to it. Okay, heroin is made from morphine, which is a natural substance that is taken from a seed pod of a certain opium poppy plant, which is seen from the photo in the slide. They are grown in Southwest Asia, Mexico, and Colombia. Heroin comes in three ways. It's white powder, brown powder, and a black sticky substance, also known as black tar heroin. Heroin is a opioid drug that is injected, sniffed, snorted, and smoked. And some people mix heroin with crack cocaine, and that mixture is called speedballing. So, for the anatomy, the organ that is mostly affected from heroin is the brain. The heroin enters the brain at a fast rate and attaches to the opioid receptors, and that gives the feeling of pain, pleasure, controlling heart rate, sleeping, and breathing. Heroin tends to be combined with additives that includes sugar, starch, powdered milk, which all can cause clogging of the blood vessels that leads to the lungs, liver, kidneys, and brain. This combination can cause permanent damage to those listed organs, and the sharing of the drug injection needle and tools can increase risk of contracting infectious diseases like HIV and hepatitis. So the physiology. So heroin is a central nervous system depressant, which means that it slows the person's brain function and influences the brain in terms of slowing down or even stopping. Not only does the breathing slow down, but the temperature and blood pressure of the person will drop. And this causes irregular heartbeats and further causes the person to either faint or go into a coma. People can overdose on heroin, and when heroin overdose occurs, the person uses enough of the drug to create a life-threatening reaction that can cause severe conditions or even death. The heroin overdose have started recently rising over the last 20 years. So the pathophysiology, people use heroin to achieve the feeling of overloaded pressure and euphoria. However, the same dosage of heroin stops causing the good feeling and the person starts to build a tolerance for that drug. This is why people increase the amount of dosages they take to keep receiving that feeling and chase that feeling. And that's why drug overdoses occur with heroin. The short-term effect of heroin usage is dry mouth, heavy feeling in legs and arms, nausea, vomiting, clouded mental function, and much more. People that use heroin over longer periods of times will start to develop insomnia, collapsed veins from constant injection, damaged tissue in the nose from snorting, infection of heart lining, stomach cramping, liver and kidney disease, lung complications like pneumonia, sexual dysfunction for males, irregular menstrual cycles for women, and much more. When people overdose on heroin, the amount of oxygen that reaches their brain is decreased, and this is called hypoxia. Hypoxia has short-term and long-term effects on the nervous system that includes brain damage and coma. So diagnosis, treatment, and AI. Diagnosis of heroin addiction evaluation usually heroin addiction diagnosis usually requires a psychiatrist, psychologist, or licensed alcohol or drug counselor to do an evaluation of the person. A diagnosis is made through blood, urine, and other lab tests that determine which drug was used and may be used to monitor the progress of treatment. The treatment process for heroin overdose is through a medicine called naloxone, which is a medication that is used to treat opioid drug overdose. Naloxone works by quickly binding to the opioid receptors and blocking the effects and feelings the person gets from heroin or other types of opioids. In some cases, people might need more than one dosage to start breathing again. And with the deaths from opioids increasing, uh, this led to this drug being available to everyone without a prescription in certain states. The treatment for heroin addiction is through multiple ranges of treatment. There are some common medications that are used in the forms of methadone, uh, buprenorphine, and naltrexone. Other forms of treatment are detoxification, group counseling, rehab, and group therapy. Artificial intelligence is being used right now to design new drugs to block the kappa opioid receptors. And the kappa opioid receptors is the feeling the brain gets when it's that good feeling, the euphoria feeling, and it reduces that feeling so that the person won't have heavy withdrawal symptoms. So that means since there will be less withdrawal symptoms or a decreased effect of the withdrawal system, the person will be less likely to go back on the drug or use again during treatment. Okay, so the demographics. The bar graph right here shows the number of U.S. overdose deaths from 1999 to 2021. The drug overdose death for heroin rose from 1,960 in 1999 to 15,482 deaths in 2017. So that's a huge jump. Before going down to 13,165 deaths in 2020, and then now it's 9,173 deaths in 2021. The lines in the graphs that go through the bars, they show the deaths that involve heroin mixing with other synthetic opioids. And so, even though there was a big increase, it's starting to come down due to more medication drugs coming out to help fight the symptoms and the withdrawal effects. So that's good, and hopefully we get the deaths a lot lower. And so this is my reference page, and thank you guys so much for listening. Thank you.